students. Today we'll discuss about the anterior triangle of the neck. So the division of the neck is called as anterior triangle and posterior triangle. As you can see, this blue color triangle is the anterior triangle and this is the posterior triangle. Okay. Now the boundaries of the anterior triangle are, you can see anteriorly it is the median plane. Anteriorly it is the median plane. Okay. So this is the median plane, right, anteriorly. Then posteriorly it is this muscle which is the sternocleidomastoid. Okay, sternocleidomastoid muscle. Okay, so posteriorly is the border of the sternocleidomastoid muscle. Superiorly it is the base of the mandible. Superiorly is the base of the mandible. And the apex above the manubrium sterni. Okay, so the apex will be at the level of manubrium sterni. So these are the boundaries of the anterior triangle. Now you can see that the triangles are divided into further smaller triangles. So let's see the posterior triangle first. So as you see, the posterior triangle, which we said is behind the posterior border of the posterior border of the sternocleidomastoid. Okay, so it's behind the posterior border of the sternocleidomastoid, and then you have this is the trapezius muscle, and below you have clavicle. Okay, so this forms the triangle, that is a posterior triangle. The posterior triangle is further divided into occipital triangle and supraclavicular triangle. Occipital triangle and supraclavicular triangle. Okay, and there is this muscle, you can see the one which is marked here with O, that means it is the omohyoid muscle. Omohyoid muscle, inferior belly of omohyoid muscle, will divide it into two further triangles, that is occipital triangle and supraclavicular triangle. Okay, this is related to posterior triangle. Coming to anterior triangle, they are marked in the blue box. So anterior triangle is present anterior to the anterior border of the sternocleidomastoid. Okay, so again remember, this is sternocleidomastoid muscle. Okay, here. So to the anterior border of the sternocleidomastoid lies the anterior triangle. Now this triangle is further divided into four triangles. Okay, so we will see submental triangle, like it will be the first triangle which we are going to look into, submental. Okay, then we will see muscular triangle, it will be the second triangle we will see. Then we will see carotid triangle, and the fourth triangle will be the submandibular triangle, also can be called as digastric triangle. Okay, so submental triangle here. Okay, and then you have the muscular triangle over here. Okay, and then you have carotid triangle. Okay, and then the submandibular triangle. Okay, so we will see the details. Like you can see here, this is a more schematic diagram. So this is the submental triangle. I said we will be looking into more details first. Submental, then below that will be the muscular triangle. Then we said we will look into carotid triangle and then submandibular triangle. Okay, so here some of the structures are shown. This is the midline. Okay, and the submental triangle. Okay, submental triangle, it is by, can you see this muscle here? This is called as digastric muscle. The digastric muscle has two bellies. This is called as the anterior belly. Okay, anterior belly of the digastric. Okay, that's the anterior belly, and then following it, this is called as the posterior belly. So the word digastric means it has two bellies. Okay, posterior belly. So that's this digastric muscle. Then you can see that actually the submandibular triangle is between the ramus of the mandible and the two bellies of digastric. Okay, the anterior belly and the posterior belly of digastric. The submental triangle is between the two anterior bellies, that is right and left on both the sides, and the hyoid bone below. Hyoid bone below. This is the hyoid bone. Okay, and then we can see that let's look into the carotid triangle. So carotid triangle will be formed by the posterior belly of digastric, this one, posterior belly of digastric, then the anterior border of sternomastoid, okay, anterior border of sternomastoid, and the omohyoid. This is called as the superior belly of omohyoid. Okay, so omohyoid muscle is divided into two bellies. Okay, it's called as superior belly. Omohyoid, here you can see this is called as superior belly, and superior belly is related in the anterior triangle, and this is the inferior belly, it is related in the posterior triangle. Okay, so superior belly forms one border of the carotid triangle. Okay, so this is the carotid triangle, this one. It is formed by omohyoid muscle, then the posterior belly of digastric, and the anterior border of sternomastoid. Okay, so that is the carotid triangle. Okay, then we are left with the muscular triangle. So muscular triangle, it is bordered by again the superior belly of omohyoid, then the continuation of this sternocleidomastoid, okay, and the midline, okay. So the triangle is here, right? So this is the triangle, right? That is the muscular triangle over here. Fine. Now here there's another concept. As you see, this bone is called as the hyoid bone. Hyoid bone. It's a U-shaped bone. Hyoid bone. Now we have muscles, suprahyoid muscles, and we have infrahyoid muscles. Suprahyoid and infrahyoid. As you can see the names over here, the suprahyoid muscles are digastric and stylohyoid. Digastric and stylohyoid. Digastric is the one which has two bellies. So we said anterior belly and posterior belly. Then you have stylohyoid. Okay. Then the next muscle, intermediate layer, will be the mylohyoid muscle. Mylohyoid muscle. And the deep one is called as geniohyoid. Geniohyoid. Okay. Okay. So these are about the suprahyoid muscles. Coming to infrahyoid muscles, there is sternohyoid and omohyoid. Then there is sternothyroid and thyrohyoid. So these are the four muscles which are called as infrahyoid muscles. Okay, infrahyoid muscles. Okay. Let's move on. So the submental triangle, I said we will be seeing the first one. Okay, submental triangle. So location is here. As you can see that you're supposed to look for the can you see these? This is the anterior belly of digastric. Can you see the two muscles over here on right and left? Okay, that's the anterior belly of digastric. Okay, and below we have the so the sides are bordered by anterior belly of digastric. Base is the hyoid bone. Okay, so this is the hyoid bone. Base is the hyoid bone. As you can notice that there is a triangle over here, right? This is called as the submental triangle. So the apex is formed at the chin. This is the apex over here at the chin. And the floor, that is the muscle which is lying below, is the right and the left mylohyoid muscle. Mylohyoid muscle. And in the midline, it forms a median raphe. Okay, can you see this white line in the center? White line in the center. So that is called as the median raphe. Median raphe. Okay. So this is the boundaries of the submental triangle, and the apex and the floor we have seen. Now what are the contents? We can see submental lymph node over here, and if you see the blue colored structures, these are the veins. So the anterior jugular vein. Okay, now coming number 2, we said we will look into the muscular triangle. So the muscular triangle boundaries are: anteriorly we have median line of the neck of the neck from the hyoid bone to the sternum. Okay, from the hyoid bone to the sternum. So right in the center over here. Okay, so this is the midline. Okay, Then you have posterior superior is superior belly of omohyoid. Superior belly of omohyoid. So can you see number 7? This number 7 is omohyoid. Okay, so that is the superior belly of omohyoid muscle. Okay, and posterior inferiorly is anterior border of sternomastoid. Sternomastoid. Okay, here the sternomastoid is removed. Okay, so anyway it continues like this below. So this is the triangle. This is the triangle. Okay, so we have the superior belly of omohyoid, then the midline of the neck, and anterior border of sternomastoid. Okay, so this forms a triangle, and this is called as a muscular triangle. So the contents are mainly the muscles. Okay, so they are the infrahyoid muscles over here. So what are they? The name of the muscles are sternohyoid. Okay, sternohyoid. Then you have omohyoid. Okay, number 6 you can see it's called sternohyoid. So it starts from the sternum and it's attached to the hyoid bone. Okay, so it's called sternohyoid. And then you have omohyoid. As I already told you that it has two bellies, superior belly and the inferior belly. Superior belly is present in the anterior triangle and inferior belly will be seen in the posterior triangle. Okay, so these two are called as superficial. They are quite superficial. Okay, these two muscles. And then the other two muscles are called sternothyroid. So the attachment is from the sternum. Okay, that's number 8 here. So from the sternum to the thyroid. Okay, to the thyroid cartilage, you can see here. So this is sternothyroid. Okay, and then we have the thyrohyoid. Then we have thyrohyoid. That's from the thyroid cartilage to the hyoid. Okay, so that's number 9. So they too are called as the deep muscles. Okay, they are deep. So these are the 4 infrahyoid muscles which are seen in the muscular triangle. Now coming to carotid triangle. So carotid triangle, I'll just show you the boundaries quickly over here. So this is the posterior belly of digastric, this one. Okay, posterior belly of digastric will form the anterior superior border. Okay, then the anterior inferior border is by the superior belly of omohyoid. Superior belly of omohyoid. This is the superior belly of omohyoid. Okay, and then the posterior border is by the sternomastoid. So this is the carotid triangle. Okay, carotid triangle. Okay, the floor is by thyrohyoid and hyoglossus, middle and inferior constrictors. Okay, we cannot see it in this diagram. And the roof is by skin, platysma muscle and cutaneous nerves. Okay, so that is the carotid triangle. Okay, so we have posterior belly of digastric, we have sternomastoid, okay, posteriorly, and the superior belly of omohyoid. Okay, the superior belly of omohyoid muscle. Okay, so all this forms the carotid triangle. Now the contents of the carotid triangle, if you look, we will have many contents. The carotid sheath, okay, very important. As you see, the name carotid is coming from the artery which is present here. We have common carotid artery. Okay, so you, in the diagram it is shown carotid sheath and its branches of the external carotid we can see over here. So the common carotid can be divided into internal carotid and external carotid with the 5 branches. Okay, so all this we can see here. Then we have the one in blue will be the internal jugular vein with its tributaries. Okay, so this is the internal jugular vein and these are the tributaries, like here you can see facial vein, retromandibular vein, external jugular vein, all this can be seen. Then the nerves are glossopharyngeal nerve, so it is number 9. Okay, the 9th cranial nerve is called as the glossopharyngeal nerve. Okay, and then we have the vagus nerve and its branches. Okay, we can see vagus nerve number 10. This is a vagus nerve. Then we can see the spinal accessory nerve number 11. Okay, we can also look for ansa cervicalis and the lymph nodes, like the deep cervical lymph nodes, which has jugulo-digastric node and the jugulo-omohyoid lymph nodes. Okay, as for the dissection hall, maybe we can only see these 3 structures, that is the artery. Okay, so we can look for the common carotid dividing into internal and external carotid. Then look for the internal jugular vein. Okay, internal jugular vein can be seen, and in between them we can see the vagus nerve. Okay, so these three structures can be clearly seen. Try to have a look into it. Okay, now coming to the fourth triangle, which is called digastric triangle. So the other name for digastric triangle will be the submandibular triangle. Okay, submandibular triangle. So obviously the name is submandibular because the submandibular gland can be seen here. Okay, so how is it formed? The base is formed by the base of the mandible. Okay, so we can see this is the base of the mandible. Okay, then we have anterior inferiorly, the anterior belly of digastric will form one boundary, and posterior inferiorly will be the posterior belly of digastric. Okay, so these are the boundaries. This is the triangle over here. It's very clear. So it's between the two bellies of digastric and the base of mandible. So this forms the digastric triangle. Okay, and yeah, also posterior belly of digastric and stylohyoid muscle. Okay, so here we can also see a muscle over here. This is the stylohyoid muscle. The stylohyoid muscle, the relation of stylohyoid muscle to posterior belly of digastric is, it will be superior to the posterior belly of digastric. Okay, stylohyoid. Whereas posterior belly of digastric, you can see it continuing with the anterior belly through the intermediate tendon. Okay, now the roof is skin, superficial fascia, and the deep fascia. The floor of the digastric is formed by mylohyoid muscle, hyoglossus muscle, and posteriorly we have the middle constrictor. Okay, so maybe few structures we can see. This is the middle constrictor of the pharynx over here posteriorly. Then we can see the hyoglossus muscle, and here we can see the mylohyoid muscle. Okay, probably in the dissection hall we cannot see this. Okay, now coming to contents of the digastric. Okay, so you can see that there are many contents. You have the superficial part of the submandibular gland. Then you will see a nerve related, that will be the hypoglossal nerve, so that's the 12th nerve. Okay, then you can also look for the lymph node, submandibular lymph node, then the facial artery. Okay, and the vein, that can be seen here. You can see this is the facial artery. Okay, and then this is the facial vein along with it. So this is a facial artery and facial vein. Then you can see the lingual artery. Okay, and okay, here this is the lingual artery. Then the mylohyoid muscle. Okay, okay, this is the mylohyoid muscle, by the way, this one. So that's the mylohyoid muscle, and you can also see the vessels along with it. So mylohyoid nerve and vessels. Okay, and submental vessels. So these are the structures related to the or the contents of the digastric triangle. Okay, now this specimen we can be seen in the hall. So look for the triangle first. So let's draw the anterior triangle first. Okay, so okay, this is the anterior triangle. Like, this is the anterior border of sternomastoid. Okay, then we have the midline, right, and we have the mandible. Okay, ramus of mandible. So this forms the anterior triangle. Now this anterior triangle is further divided into 4 triangles, we said. Okay, so this is the submental triangle. So what I'm drawing, this is the anterior belly of digastric. Okay, and on the other side also we have anterior belly of digastric, and below we have the base is by the hyoid bone. Okay, so this is the submental triangle. Okay, submental triangle. However, in the body we just have one submental triangle. Okay, so submental triangle is formed by both right and left half triangles together. Okay, submental triangle. Then let's look for the muscular triangle. Okay, so the muscular triangle will be formed by, here we said this is the superior belly of omohyoid. then this is the sternocleidomastoid, okay, and this is the midline, okay. So this forms the muscular triangle, okay. Muscular, number 2 is the muscular triangle, and there are 4 muscles over here, okay. These are all the infrahyoid muscles, okay. Sternohyoid, sternothyroid, omohyoid, and thyrohyoid, okay. These are the 4 muscles, okay. Then coming to the carotid triangle. So the carotid triangle is formed by the superior belly of omohyoid, then the sternomastoid, okay, and the posterior belly of digastric. So this forms the carotid triangle, okay. So that's number 3, carotid triangle, okay. And this is the place, quite important, carotid triangle, and you need to look for the internal carotid artery branching from the common carotid and external carotid artery. So when you search for the internal carotid artery, usually it does not give any branches, whereas external carotid artery will give branches. Then you can also look for the vein, that is the internal jugular vein. If you compare between the artery and the vein will be thin walled, okay. And in between the two we should look for vagus nerve, okay. Next, coming to the 4th triangle, that is it's called as the submandibular triangle or digastric triangle. It is formed by the base of the mandible and the 2 digastric muscles, okay. So this is the anterior belly, right. Let me first tell you the triangle. So this is the triangle here. This is the 4th triangle. So that is the submandibular triangle. Okay, submandibular triangle. It is formed by the two digastric, anterior belly of digastric, posterior belly of digastric, and the base of the mandible, okay. I hope it's clear. Please kindly see all the structures and benefit from the video. Thank you.